It mumbles your first word, says last goodbyes. It licks obstacles, captures souls, speaks without speaking. Your mouth is who you are. Give it the care it deserves with Delta Dental of Massachusetts. Ask for Delta Dental at work or contact us for individual coverage. We are the #1 dental plan in America. We are spreading smiles.
This morning on Today's Health, kids and the dentist. Remember this scene?
What is this? Boys, what is it?
I only have one cavity.
Oh, your checkup. We did it.
Well, you might be able to relate to what they were saying at their age, but now cavities in kids may be a thing of the past, and Dr. Doyle Williams is and national spokesman for the Children's Oral Health, which is an organization that helps children. Thank you so much for joining us, doctor. So listen, here's the bottom line. Let's talk about the first thing. You say that this is a disease we really need to pay close attention to, not just because of cavities, but why?
This is the leading childhood disease in America today. 3 out of 4 children will suffer from this before they graduate from high school, and 1 in 10 children goes to school every day with it having suffered from a toothache that kept them awake at night. And their teachers report that they're unable to learn or study or concentrate or even socialize.
It's not sugar. We keep saying to kids, don't eat candy because it's going to cause you cavities. But what actually causes cavities?
Sugar is merely the nutrient source for the bacteria. It's a strep mutant bacteria. We've got to eliminate or inactivate the bacteria if we would like to eliminate tooth decay in America.
Where does the bacteria come from?
The bacteria is spread typically from family members. So very often you've probably had a child and they had an ice cream cone that was about to drip and you might have licked it and then handed it back to the child. You just inoculated them with your bacteria from your mouth. So
basically children are born without the bacteria that causes cavities, and through adults they get the bacteria.
Correct.
So, boy, that's a little sobering. Can you give it to your child when you're pregnant?
No. So it's very important that during pregnancy, a pregnant woman maintain good oral hygiene so she can eliminate the bacteria
in her own mouth.
In her own mouth. So when that newborn child comes, it is not spread.
So how do you eliminate the bacteria?
One of the great products is xylitol. It's a totally natural sugar found in lots of fresh fruits and berries like blueberries and cranberries. And eating these types of things or using these products that are commercially available, the chewing gums, the mints, the toothpaste, the mouthwash that use xylitol can all inactivate the bacteria.
We're going to get to more of your tips coming up, but one of the other things you talk about is sealants. There's a way to, and my kids actually do that, and it's really something. If you've got little cracks in your teeth, you put a little sealant in there, and it prevents the cavities from forming.
Exactly right. It's 100% effective, and sealants last about 8 to 10 years. They should be placed on molar teeth, permanent molar teeth, so that occurs at 6 years of age when the 6-year molars come in, and again at 12 years of age when the second molars come in.
A vaccine is coming in a couple of years, but until that would prevent a child from being able to get the bacteria. But until then, this is what we have to do. We've got to teach our kids and ourselves as well to eat more blueberries and cranberries because they have a natural occurring xylitol, right? That
An
helps
excellent
us.
source, yes.
Also, you say ask your dentist about the sealants and the xylitol, but also brush and floss teeth twice daily. That's, of course, a good idea. And you also don't share what's in your mouth. So, Mom, don't, eat something and then give your kid a bite because you might be passing along this bacteria.
Keep it there. If it's in your mouth, keep it there. So commonly, we have a mother who might be fixing dinner, taste the dinner, and use that same utensil to stir dinner again. These are just various ways of spreading the bacteria.
Okay, and also maintain good oral health yourself because that'll really help you. And are these little mints, these kinds of things, a good idea?
These are terrific. So these are chewing gums, mouthwash, mints.
That can
all
help
of these
get rid
that
of
have
the bacteria.
xylitol that inactivates the
Dr.
bacteria.
Doyle Williams, thank you so much this morning. Very helpful advice.
Thank you.